December 1st is World AIDS Day, and it's a day to unite with others around the world to prevent HIV, support people with HIV, and remember those who have lost their lives to an HIV-related illness. Now, we hear from the director of the Florida Department of Health in Hillsborough County, Dr. Doug Holt.
Seems like COVID has affected everything for 2020 and even World AIDS Day. One of the amazing things is that much of what we've learned and fought for with HIV is helping us as a society deal with the next or the current epidemic. But on a personal level, the impact of COVID for World AIDS Day for me has been another challenging. I feel separated. World AIDS Day is like my second Thanksgiving. I get together with my second family that has been fighting this epidemic for 40 plus years. So this year, I'm going to miss being in person. I get energized with this, but I'd like to make a few comments about it. The theme this year is ending the HIV/AIDS epidemic, resilience and impact. Resilience, I have a definition that I think is very appropriate. It's knowing how to cope in spite of setbacks, barriers, limited resources. That certainly defines what we've struggled with and continued the fight for the past 40 years. It's a measure of how much you are willing to overcome obstacles to get what you want, how much you really care. All of us know, or I believe, want nothing more than to end the HIV epidemic. I'd like to thank everyone for doing their part to stop new infections and to provide access to everything an HIV-infected person needs, whether it's prevention, therapies, education, care, and probably most of all is just comfort and love. So again, I wish you are all here with me in person. The fight continues, and I'll see you next year in person. Thank you very much.
Being informed and getting tested are some of the most important things you can do to protect your health. There are many ways people can get tested. Early interventions consultant Tequila Harris explains how it works.
Here we have our OraQuick at-home test kit. The Florida Department of Health will send you a kit for free where you can test in the comfort of your own home. Here we have an actual test kit. The first thing you want to do is look on the bottom. You want to look at the expiration date. This kit is expired. This is what I'll be using as a demo kit, but make sure you don't use a test kit that is expired. Next, there'll be tape that's on the top of the box. You might want to take a sharp instrument and cut that open. This is already open. You have a nice sturdy package that says OraQuick. This is the same brand that we use in the clinics for oral testing. We don't test saliva, we test something called oral mucosal transudate, which we'll get into. So you can open your test kit. It has tutorials in Spanish and in English, and it goes through the specifics of the test, and it has a number, 1-866-436-6527. If at any point you have questions about your test or you need to talk to someone. So with that, you slide the tray out, and in the tray you have your test tube. That's where your test will actually be inserted. You have your test stick. This will be actually running your test. You have your HIV Testing in Me. You read this booklet first. It has a lot of pertinent information. You also have what your results mean. This book will help you interpret your results. And if you have any questions, like I said, you can definitely call that 1-866 number. You also have a nice little golf pencil to jot down any notes that you have, and your package insert. that has pertinent information about the test and about what you should and shouldn't do prior to it. I would definitely suggest reading this information prior to testing so you can familiarize yourself with the test. So what we're gonna do is I'm actually gonna run through with you and show you how to test. Now, first things first, these tests don't need to be held, they're temperature sensitive, so don't keep them in your car or keep them in a very hot environment. You need to store it between 36 degrees to 80 degrees Fahrenheit or 2 degrees to 27 degrees Celsius. You don't need to eat anything, brush your teeth, or use mouthwash about 30 minutes prior to your test. So we don't want to affect anything that goes on with the test. So the first thing you're going to do, you have a notch. You're going to open the test tube with this notch. You're gonna simply screw the cap off. And because it is a liquid, you want to make sure that you don't spill it. So that's why they have a nice test tube holder. You press with a little pressure and you'll hear a click. The next thing you want to do is open the notch of the test stick. You only touch the bottom portion of it. And then you're going to simply test your smile. It's a smile. So you're just going to go along the top, flip it, and along the bottom. And that's all. You put the test in, and it will process for approximately 20 minutes. You have a control line, a C, that means control. And so if a line pops up there, that means it's great. That means the test is working. If a second line were to appear, that's the test line, or T. That means antibodies for HIV was found in your blood. At that point, you would call your healthcare professional, that 1-866 number, or you can call the Florida HIV/AIDS hotline to get linked into care. Now, these tests are absolutely confidential. You do them in the comfort of your own home, so we can't actually report these tests. So you can come into the clinic or your doctor's office for linkage to care. There they'll do a confirmatory test via blood work or OraSure and send that off to the lab. You can come in with no appointment necessary at the health department. It's called same-day access. Or you can call any of our local CBOs or community-based organizations to get linked into care.
While you may be familiar with HIV, you may not know the history. Dr. Sambunwit takes us back to the basics.
HIV stands for Human Immunodeficiency Virus. So it's a virus that was discovered back in the 80s. And we believe that the first case probably back in the late 70s. We have a starting of the epidemic of HIV in the 80s, which we start seeing that among people that presenting with severe infections that normally not happening in people with normal immune system. So later on, we discovered that this virus, which is an RNA virus, how it is important because it can integrate itself inside our cells and it can hide in our body for a very long time. What it does is destroy the immune cells, one of the white blood cells called CD4 lymphocyte, and these cells are eaten basically and destroyed by the viruses so that the body cannot produce immunity against certain infections, such as certain fungal infection, tuberculosis, some viral infection, and also it really depletes the ability of the body to produce antibody against certain bacterial infection as well. So you can see that when patients come in with HIV early presentation, they might have increased susceptibility of certain bacterial infections, but when the immune system got destroyed enough, you start seeing a lot of odd infection that you're typically not seeing in general population. Those infections are called opportunistic infections. Actually, in the past decade, we learned a little bit more about it, that not only HIV destroys the immune system, but it's also activate the body inflammatory response. As a result, even though the person doesn't really have the spectrum that we call AIDS, that call acquired immunodeficiency syndrome. AIDS is when you really have a lot of depletion of immune system. But when people have HIV and the body produces the immune response, increased inflammation, what you see a lot of organ damage, such as you have increased atherosclerosis that we see in patient HIV. We have increase in the pressure inside the lung circulation system called pulmonary hypertension. Some patients might have a lot of neurocognitive issues like memory loss and things like that we can see as more chronic complication of HIV. And when those certain infections that typically not happen in normal people, that's one of the presentation that's called AIDS-defining illness. But when the number also drop, when CD4 lymphocyte drop less than 200 point level, that's also by definition is called AIDS. So patients that have AIDS is really gonna have to get over the hump that treat themselves, take care of themselves, go to see the doctors so that they can treat those infections, and at the same time treat the HIV, the virus that causes AIDS, so that they can restore the immune system and be back to close to normal as possible. There are several activities that can cause that. Anything that involves blood, certain secretions can transmit the virus. So in the old days, the early case of HIV or AIDS got by blood transfusion, because back then we don't really screen those blood products, but nowadays we screen those blood products. Therefore, transmission by blood transfusion is very, very rare. HIV is transmitted by blood products, secretions. This is the reason why it is an equal opportunity of transmission. It doesn't choose your gender, your race, your age, and what you do for a living. In the old days, it was transmitted by blood transfusion. Now, with blood transfusion has been screened, that has not really been a big issue. However, sexual contact is a big one, unprotected sex, and also injecting drug use. In Tampa Bay, we found that bisexual transmission is more, and really you cannot tell if your partner have HIV or not. Currently, there is no cure for HIV. The scientists and doctors work very hard to find a cure, but right now when you're undetectable, this means your disease is under control. It is, however, is very important for you, if you have HIV, for you to take care of yourself and take your medication so that you can be undetectable, so that not only you can reduce all the complications from HIV, and also you can restore your immune system. More importantly, you can protect your partners, because when you are undetectable is equal to untransmissible. You really protect your partner by taking care of yourself. When somebody with HIV, when they start taking the medication, those drugs that we have right now are very good. They typically are very easy to take. There are a lot of options of one pill, one a day that you can take. However, if there is any factors at all that make preventing you taking the medication regularly at the same time and go follow up with your doctors, those can be the factors that preventing you to achieve undetectable. Now, what is important is why you're not able to take medication every day. Could be because simply forgetting, or you don't you are not prescribed the right regimen that fits your lifestyle, or perhaps you just have a lot going on, or certain risk behavior. If you're drunk, you will forget taking the pills. If you use drugs, and then your consciousness is impaired, that also can be the factor that preventing you taking medication regularly. We had come a long way with great medication that really over 95%, if you take it regularly, you will suppress the virus. The virus, however, is very smart. If you're not taking medication regularly, you can have resistance. And with that, will complicate your regimen, how you're gonna suppress the virus. If you don't have HIV, it is also very important for you to know your status. The CDC has recommended person that is adult age up to 64 years old that should have HIV test at least once in part of their medical care, at least once. If you increase high risk, for example, you change sexual partners, you active injecting drug use, it is very important that you check at least once a year. Know your status so that you can hit it early. It is very important also to disclose your status. It is also very important to know your status so that you can not only protect yourself, but also protect your partner.
When someone is diagnosed with HIV, there are ways to prevent the virus from spreading to others or causing serious health issues. Dr. Moreno explains how.
So U equals U is a wonderful concept that undetectable is untransmittable. That means people living with HIV, if they take their antiretroviral therapy every day and have an undetectable viral load for about 6 months, they're unable to transmit the virus to another person. The good news is that people living with HIV can have sexual relations if they use protective measures such as condoms. Ideally, it's good to wait for someone to be on therapy and to be undetectable, but it shouldn't interrupt any relationships as long as barrier protection is used, such as a condom. Once someone obtains an undetectable status, and that's typically less than 20 copies per milliliter, so we can't detect any virus, we actually have to continue that medication for the person's lifetime at this moment. The HIV virus creates a latency. It actually goes into hibernation in the body. So we have to maintain those antiretrovirals to control the virus. If someone goes off the antiretroviral therapy, that virus reawakens and starts replicating again. So currently in time, we need to continue those medications as a daily regimen to suppress the virus. That's very, very important. Hopefully in the future, we'll have long-acting antiretrovirals that can be injected almost every 8 weeks or potentially a year. And someday, we're hoping we're working very hard towards a cure, but we're not there yet. So please remember, for anyone living with HIV, we need to take those medicines regularly, work with your healthcare provider, and to make sure those levels are checked so the person is undetectable. Undetectable means untransmittable because they did a wonderful study, a series of studies, 2016, 2017, called the Partner Study, where they went through many, many countries, and they found people who are living with HIV who have an undetectable virus, they actually were not able to transmit the virus even without using condoms and other types of protection, as long as they were on their antiretroviral therapy. That is a big, big, discovery, because not only are people unable to transmit it to other people, but pregnant women are less likely to pass it along to their children as well. So that's very important for people to stay healthy who are living with HIV, but also so they can resume and not have stigma in terms of interacting with other people. So someone living with HIV, remember, has a suppressed immune system. So that immune system is fighting a virus and is undergoing an inflammatory state. That's another reason why it's so important to take those antiretroviral therapies so the body has less inflammation and less overall health. Now, if someone is diagnosed with conditions such as cancer, or if they become a little bit more stressed in their life or undergo a pneumonia, exactly right, that virus can actually resurge because of the stress in the body. That's why it's so important for people living with HIV to take care of themselves, but also to take their antiretrovirals, but also if they know that they're going to have other types of conditions, to remember that they might also be transmittable again to partners or loved ones. Our goal as a team, and our goal of World AIDS Day, is to bring awareness so we prevent HIV infection. Our goal is to give as much education as we can to the community so people are armed with the knowledge that they're empowered, that they can make those decisions in their life to prevent transmission of the virus to themselves. Now, if someone is diagnosed, so someone's not feeling well, they have a diagnosis of HIV, they get tested in the community, we want them to feel that this is a safe place. They can come and see us. We have same-day access and treatment. We can get someone on antiretroviral therapy that same day. So the process is really, you can give us a call, you can come downtown, you can work with many of our community providers. We want them to feel safe and also very comfortable in talking with us, because we are on your team. We want you to get better. We want to work with you as a team to make sure that you optimize your health and you keep your friends, families, and loved ones also safe. So to summarize, we have hours all during work hours. We're working on trying to get weekend hours as well. Come downtown, we can get you on treatment, and then we can also do telemedicine. We can see you through video, we can see you through telephone. We can really get creative in terms of your care, getting labs at other DOH facilities, getting outpatient labs. So we want you to know that we are really in partnership with you, that you can come and get treatment, and we want to be on your side and help you through it. There's certainly a lot of information on the internet. Not all of that is accurate. So we want you to feel that we are your trusted source, not only the Florida Department of Health, but also the CDC. Those are the main websites. There's also www.poz.com, pause.com, and also www.thebody.com, which really gives great insights and has, I think, vignettes and examples of folks just like the folks we see coming in, anybody who's wondering about HIV. We are working hard to give the education not only to prevent HIV infection, but also if someone is infected, we can make sure that person feels comfortable with the diagnosis and that we optimize their health as much as possible. If you want to be one of our diplomats or people into the community who spread the word on prevention and treatment, please also get in touch with one of our Florida Health representatives. We really value your input. We really want to end the epidemic with your help.
Medicine is an option to prevent the spread of HIV. There's medicine for people who may have been recently exposed that can stop others from getting HIV. There's also medicine for people who are at a higher risk of getting HIV. Family nurse practitioner Jennifer Alseth explains the various options.
nPEP is post-exposure prophylaxis for HIV. This is for, a medication that is given to help prevent HIV for people that are exposed to somebody that has HIV or unknown exposure via sex or even bodily fluids. nPEP is very effective, and we continue to monitor you to make sure that it is still effective in helping prevent the transmission of HIV. nPEP is right for you if you have been in contact with somebody that's HIV positive, or you have unknown exposure to somebody within 72 hours, whether that's through sex or even needles or even bodily fluids. You will need a prescription for nPEP medication, and we tailor our medication prescriptions to the patient. Here at the health department, we have many resources available for our patients. If you have insurance or don't have insurance, we have your back. This medication is only given for 28 days to prevent HIV. And during that time, you're gonna have routine labs that we're gonna have you come in and complete, as well as after taking it, to make sure that there aren't problems with your bones, kidneys, and most importantly, that you're HIV negative. PrEP is very effective in helping prevent HIV. It's very important to take the medication at the same time every day, and PrEP with the use of condoms prevents HIV and other STDs at a 99% chance. This is a personal decision that you need to evaluate. Do you have multiple sexual partners? Do you do drugs? These are very important things in knowing that you're at a risk of getting HIV and how to prevent the transmission of HIV for yourself. You have to know that you are important and you need to do everything you can to protect yourself. Short-term or long-term side effects when it comes to this medication, depending on which medicine it is, whether it's Descovy or Truvada, both have the risk factors of affecting your kidneys, your liver function, and so because of that, we require our patients to come in every 3 months for routine lab work as well as screening, and most importantly, making sure that you're HIV negative. Test and treat is a rapid initiation of antiviral medications. This is for our newly infected HIV patients and our patients that are coming back into care. And the reason why this is important is because we want to help reduce the viral load and transmission of HIV in our community. Test and treat is important to our HIV patients because it helps improve your long-term outcomes of being HIV infected by starting the medication right off the bat. And it also helps reduce the transmission in our local community. So the process for somebody who comes in to get tested and treated is one that they're gonna have to come into the health department, because of course that's the first thing to do, right? And then after getting registered, you're gonna come in and get a lot of different lab work done. Once the labs are completed, then you'll be seeing a nurse and a provider, and a nurse afterwards to give you your medication. The process typically takes about 2 hours from start to finish, from the moment you walk in to the moment you're out. Depending on the patient, the provider will come up with a plan with the patient about whether to start medication, wait, or delay even starting medication, but it's the process of getting into care.
Unprotected sexual activities are the cause of most STDs or STIs. patients often tell clinical staff they didn't practice safe sex. Taniki McNeil is a health department nurse who highlights the importance of safe sex.
So the first thing people can do to protect themselves for STDs is protective measures such as condoms. We have things as dental dam. We have oral condoms that are used for oral sex. They also can protect themselves by getting tested and knowing their status before they engage in sex with a new partner. So it's important for people to practice safe sex in order to decrease the transmission of STIs. So some of the myths that we often hear in the STI clinic is that patients come in and they say their partner didn't look like they had anything, or that their partner is too educated to have anything, or their partner is not a minority, or their partner isn't a drug user, or their partner, doesn't sleep around. And we know that pretty much STIs can be transmitted to any person. It does not matter if your ethnicity or your education or your income. STIs basically are transmitted because of lack of protection. So all those things are big myths. The other myth that we hear within the clinic is that oral sex is less of a mode of transmission for STIs. Basically, you can carry around gonorrhea and chlamydia in the throat with no signs and symptoms. So it's very important to have a throat swab or an oral swab conducted, because you can transmit that even if you're not engaging in insertive sex. We often hear a story about a monogamous couple, be married or not, where they are exclusive and one partner may go out of town, they may go on vacation, it may be a girl's or a guy's trip, and they actually have a hookup. They oftentimes come into the STI clinic because now they're having signs and symptoms of some form of STI. They actually are positive because of this one-time hookup, though they're in a monogamous relationship. And then we also have to treat the partner as a contact. And that is one of the things that we have to deal with on a day-to-day basis. I believe that everyone should be tested annually. So this can be done one of two ways. You can get it while you do your primary care visits, or you simply can walk into one of our STI county health departments and get your annual testing. We often have clients who come in and they actually write on their paperwork, they are here for their annual screening. This can be done at your GYN, at your PCP, but I think everyone should be tested annually. I would describe safe sex as not only using barrier methods, but also being informed on what STIs look like, what are those signs and symptoms, what you and your partner discuss as what types of sex you're going to have, what are you willing to engage in. There should also be consent in sex. So safe sex is just not about barrier methods, but it's also a conversation that you have with your partner about expectations and consent and signs and symptoms and education and prevention. So there is a hygienic component to sex. For example, if you have a male who is uncircumcised, meaning that he has extra skin, that skin can actually hold the secretions and increase the risk of STI transmission. So testing for STIs doesn't only involve blood and urine. You also should get point of contact testing. So that means that if you engage in oral sex, you should have an oral swab. If you engage in rectal sex, you should have a rectal swab. This allows us to test for gonorrhea, chlamydia in those particular sites. So in Hillsborough County, there are several places to get tested. You can get tested at your county health departments, your local community-based agencies such as YYC or Metro. You also can get tested at any of our ERs and also urgent care facilities. So I would describe safe sex as number one, being informed, knowing exactly what STIs consist of, what are the signs and symptoms, and how your activity plays in your risk. So that would be one of the things that I would say as far as safe sex. Secondly, you should know what barrier methods to use, whether or not it's a condom, oral condom, dental dam. Thirdly, where to get treated if you are positive for an STI. So if you are in a new relationship and you have a partner and you don't know how to quite approach them in order for them to come down and get tested, this can be a casual conversation that you can have with your partner. Hey, we're thinking about taking our relationship to another level. So we can go get tested at our county health department, or you can go to your primary care individually. With this, before you actually engage in sex, it takes about 5 to 7 days to get your results back. So before you actually engage in sex, you can actually compare those results. You can have your partner look at those results. Both partners are negative. It's an easy way to prevent an STI instead of having to treat it after it's already been transmitted.
Those who need treatment for STDs and STIs can always count on the Florida Department of Health in Hillsborough County to be there for them. Maritza Acosta gives an overview of the Specialty Care Center.
Upon arrival, everyone gets pre-screened for COVID. Then they get a letter or a number assigned for they can get directed to the services they need. The services include here are HIV, STD testing, and care for HIV. We're a one-stop shop. We have the clinic with medical services. We have behavioral health services, dental services, lab, pharmacy, AIDS drug assistance program. We work with many community agencies, including Tampa General Hospital and University of South Florida, and other case management agencies that serve our clients. An established client here usually gets labs 2 weeks before their appointment, which is here in the same location at the Specialty Care Center. It's a walk-in services, and they will have an appointment with a medical provider, either face-to-face or currently we're doing telehealth visits in about 2 to 3 weeks after they get their labs. It's a review of labs, checking other health issues that they may have, and like I mentioned earlier, we do have a pharmacy next door. The Specialty Care Center is a one-stop shop where we serve the community that needs us because either they're HIV positive, they need care for HIV positive treatment, or they want STD testing. We actually see ages from 13 and over for testing. We see clients that have funding, private insurance, and clients that don't have insurance. We help them with medications, we help them with behavioral health, dental services, GYN. We're open access, one-stop shop.
While good oral hygiene is important for everyone, it's even more important for those living with HIV. Dr. Imanov explains why.
Dental care is very important for people who have HIV. It's important both from a medical perspective as well as from a social perspective. So the importance in the medical side has to do with getting proper nutrition in order to be healthy, and also in order to be able to take the daily medication to suppress the virus. The problem arises with patients that don't have good teeth, that are constantly in pain, and oftentimes that leads to non-compliance with their HIV medicine. Well, there's a two-pronged importance to dental care for HIV patients. The one side deals with the medical aspects of dental care. That means that the patient needs to have a healthy dentition in order to be able to get the proper diet and to be healthy in order to take their medication for HIV daily. And then there's the social aspect that deals with them having good enough teeth in order to get a position of employment, in order to have good social contacts and a healthy social environment. So, of course, we put more emphasis on the medical aspects to make sure that the patients don't have active tooth abscesses, toothaches, broken teeth, things that would prevent them from chewing healthy food and taking their medicine. Our clinic focuses on the basics. We do cleanings, exams, we do fillings for our patients. And another major arm of what we provide is partials and dentures. So we try to restore people's dentition when they're missing multiple teeth or all of their teeth in order for them to be able to chew properly and also be presentable in an employment environment. We work together with the medical side as well as the eligibility side, which is ADAP and Ryan White, to make sure that patients get their care promptly. This is both for patients that may be having an emergency, they may be having a toothache, an abscessed tooth that needs to be taken care of urgently, as well as patients that are just coming into the system. Maybe they were newly diagnosed, they've just seen their medical provider. They coordinate with us so that we get those patients in quickly and get them scheduled for their initial dental exam. The one thing we emphasize for patients is if they're in our clinic here, we have sharing of the labs and important medical data, which makes the access very easy for us. We do have quite a few patients that go to outside providers, and the important thing for those patients, whether they come to me or to any other dentist's office, is for them to always bring a complete set of paperwork with them. because being an HIV patient, it's very important for the dentist to have access to their labs, to their medications, and their thorough health history. So if your dentist or medical doctor are at different organizations, the patient needs to remember to bring that package of information with them.
By working together, it's possible to end the HIV epidemic, and there's a plan to achieve this goal. Carlos Mercado explains the plan.
The president came up with an ambitious plan to end the HIV epidemic in America in 10 years, with a goal of reducing HIV infections by 75% in 5 years, and then the rest 25% by 2030. The plan is composed of 4 different pillars: diagnose, treat, protect, and respond. And one of the things that we wanted to do this year in the World AIDS Day is to highlight the fact that despite the COVID pandemic response that the health department has been engaged in, we still have been working on fulfilling the promise made by the president to end the HIV epidemic. So between the communities impacted by the epidemic and some community partners, along with the Health Council of West Florida, we have been preparing a plan that was going to be soon implemented. Those plans actually have 10 goals across the 4 different pillars. So I wanted to be able to express to the community, make them aware that this plan is ongoing and it's going to be put in place soon. And if they have input, we would like to hear. So the first plan on the first goal on the diagnose pillar is to expand the number of folks in the community that are aware of their HIV status by 7% by the year 2023. Every date is not to the full implementation of the plan, but there are stages where the plan is going to be implemented, trying to achieve the goal of eradicating the HIV epidemic by 2030. Under pillar 2, there is several, which is the treat pillar. There are several goals, and the first one is to expand the number of people living with HIV in the community that are actually receiving care and treatment, including those who are either newly diagnosed or people who have fallen out of care. We want people in the community to know that if they need care, care is available. Another goal under this pillar is to improve by 5%, expand the access to care for folks that are not virus suppressed. When someone is diagnosed with HIV, one of the goals is to get them into care, to retain them in care, to make sure that they're adhering to the medication so they can be virus suppressed. It has been proven, scientifically proven, that by someone who's virus suppressed, it is not infectious, meaning that they cannot transmit the virus through sex. So that's one of our other goals. Under pillar number 3, the prevention pillar, we have 5 goals. This is the most ambitious one. The number 1 goal is to utilize existing or develop new strategies to increase PrEP access. PrEP is a medication that's been around for a while. It is intended for folks who may be at risk through work or maybe some behaviors to take this medication and to prevent HIV. So in the community, we do have, they have a goal that we will increase the utilization of this medication by 25% by 2024. Goal number 2 is to coordinate, develop a coordinated system that allows the PrEP timely delivery of nPEP. And nPEP is somewhat of the morning after pill for comparable to pregnancy. When someone has unprotected sex that may be with someone who was infected or they know that they became infected, that within 72 hours people can take this medication and significantly reduce the chance of them getting HIV. Typically, there's some limitations on the access right now. We want to expand the access to be able to be available during weekends and after hours, which may not be the case at the moment. Goal number 3 under this pillar is that by December 2024, we're going to have a comprehensive access to syringe exchange program. We have been working with the county government after the legislature this year passed the statute authorizing syringe exchange programs across the state. to stand up our own serum exchange program that is going to collaboration between the county, TGA, and USF. And the goal number 4 under this pillar is that by December 2024 to reduce stigma by leveraging community-wide target initiatives and increasing, changing the attitude for people who may think that getting tested for HIV is somehow putting them at highlighting their behaviors or whatnot. The U.S. Task Force for Preventive Medicine has recommended that anyone between the ages of 13 to 65 get tested at least once in their lifetime for HIV. However, if they have other higher risk factors, they should be tested more often. And then the last goal on the pillar 3 is that we want to maintain the goal of preventing perinatal HIV cases. The county has been blessed by not having a perinatal case last year. We have worked very hard to make sure that happening, and in this day and age, preventing cases of babies born with HIV, it is possible. Care is available, and people just need to make sure that they're available themselves of the care. And finally, under pillar 4, which is the response pillar, by February 2025, we want to have a county-wide strategy that responds to the HIV transmission networks. We know that there is different populations in the community that may be at higher risk of contracting HIV, and we really want to make inroads with those populations to provide them and make them aware of what services are available in order to prevent them from getting HIV infection and continuing the epidemic. And then goal number 2 is that the plan is to define a baseline to increase community capacity so we can reduce the new incidence of HIV. So one other thing that we want to do is really provide some resources where people can get information and be engaged. The federal government has a website that is devoted to HIV.gov, and the Health Council for the West Florida site is also a resource, and the Ryan White Care Council of West Central Florida that covers more than Hillsborough, Pinellas, and other counties in this area. Finally, we have the Department of Health website, hillsborough.florahealth.gov, and we would like people to contribute and post their observations and thoughts on social media using the hashtag World AIDS Day.
On behalf of the Florida Department of Health in Hillsborough County, we thank you for watching the World AIDS Day virtual presentation. We hope you take this information and apply it to your lives.